Signs of HIV in women, common symptoms you might overlook. Not everyone's journey with HIV unfolds in the same way, illustrating the complex and varied nature of this virus. Among the intriguing findings in HIV research is the existence of a remarkable group known as elite controllers. These individuals possess immune systems that have a unique ability to suppress the virus effectively and naturally, allowing them to live without the need for antiretroviral medications. In addition to this group, there are also individuals whose bodies seem to have a natural defense against HIV. Even when exposed to partners who are HIV positive, they do not contract the virus. This fascinating diversity in immune responses highlights the potential for unique biological characteristics in the fight against HIV. Biological differences play a significant role in why women are more susceptible to certain infections, including HIV. For example, the female genitals have a larger surface area than the male genitals, which means it has greater exposure to the virus found in semen. Additionally, factors like vaginal infections can heighten this risk even further. On the same note, extensive research reveals a striking disparity in the risk of HIV infection, with women facing a significantly greater threat compared to men. This vulnerability stems from a combination of biological and social factors. Biologically, women's anatomy can inherently heighten their susceptibility to the virus during sexual intercourse. Moreover, social determinants such as unequal power dynamics, pervasive stigma surrounding HIV, limited access to healthcare, and deep-rooted economic inequalities further intensify this risk. In the world of HIV research, an eye-opening study has revealed a striking difference in infection rates between men and women. For those in monogamous relationships, women face a significantly higher risk, 19% compared to just 4% for men. What's even more alarming is that this risk intensifies with the number of sexual partners. In various scenarios, women can experience a relative risk ranging from 3.0 to as high as 5.4 times that of men. Epidemiologically speaking, women make up about half of the global population living with HIV, but the numbers paint a concerning picture. For every 100 new diagnoses, only 17 are women while a staggering 83 are men. This stark contrast highlights a considerable gender disparity in new infections, emphasizing the need for targeted awareness and prevention efforts. In 1991, basketball legend Magic Johnson stunned the world when he announced he was HIV positive. While his story captured global attention, countless women have silently battled this condition, often missing crucial early warning signs. Today in America, HIV continues to cast its shadow, particularly in states like Georgia, where new infection rates are 24.9 per 100,000 people, followed by Florida at 22.9, and Louisiana at 22.1 per 100,000 residents. The global picture tells an even more sobering story. According to the World Health Organization, women account for more than half of the 38.4 million people living with HIV worldwide. In the United States alone, approximately 23% of new HIV diagnoses are among women, with Black and Hispanic women bearing a disproportionate burden of the epidemic. Dr. Sarah Martinez, a leading HIV researcher at Johns Hopkins University, shares a story that haunts her to this day. A young woman came to my clinic feeling perfectly healthy, just for a routine checkup. She had no idea she'd been living with HIV for nearly 5 years. By the time we caught it, her immune system had already suffered significant damage. If only she'd recognized the early signs. The truth is, HIV symptoms in women can be surprisingly different from those in men, and many of these signs masquerade as common, everyday health issues. This reality makes early detection particularly challenging for women, who might dismiss these symptoms as normal fatigue or stress-related problems. Recent research from the Centers for Disease Control and Prevention reveals that men typically take 2 to 4 years longer than women to receive an HIV diagnosis after infection. This delay isn't just a number, it represents countless missed opportunities for early intervention and treatment. The medical community has made remarkable strides in HIV treatment and management. Yet, despite these advances, women continue to face unique challenges in recognizing and receiving timely diagnosis for HIV infection. Understanding these gender-specific symptoms isn't just important, it could be life-saving. 1. What makes HIV detection in women particularly challenging is how its symptoms mirror those of other common conditions. Take Sarah's case, a 32-year-old teacher from Atlanta. For months, she attributed her persistent fatigue and night sweats to her demanding job and stress. These symptoms, as she later learned, weren't just job-related exhaustion, they were early indicators of HIV. Unlike common fatigue from overwork, HIV-related exhaustion doesn't improve with rest. Dr. Rachel Wong from the University of California, San Francisco explains that this fatigue stems from the virus's impact on the immune system, making it distinctly different from regular tiredness. While chronic fatigue syndrome might cause similar exhaustion, HIV-related fatigue often accompanies other subtle changes in the body. 2. Unusual skin changes serve as another crucial warning sign. Many women mistake HIV-related rashes for eczema or allergic reactions. However, HIV rashes typically appear as flat, red areas covered with small bumps, often affecting areas that eczema rarely touches, such as the trunk and thighs. Unlike typical allergic reactions that resolve within days, these rashes persist and may worsen over time. 3. A groundbreaking study published in the Journal of Women's Health in 2023 revealed that women with undiagnosed HIV often experience recurring vaginal yeast infections resistant to over-the-counter treatments. While occasional yeast infections affect 3 out of 4 women at some point, HIV-positive women may face infections that return every few weeks, defying standard treatments. 4. Unexplained weight loss tells another story. When Elena, a Miami restaurant owner, lost 15 pounds without trying, she initially celebrated what she thought was a positive change. But unlike intentional weight loss through diet and exercise, HIV-related weight loss occurs despite normal eating habits. This differs from thyroid disorders, where weight changes often accompany visible neck swelling and temperature sensitivity. 5. Night sweats associated with HIV feel different from those experienced during menopause. Dr. Martinez notes that HIV-related night sweats often soak through bedding and occur regardless of room temperature, while menopausal night sweats typically respond to environmental adjustments and hormone therapy. 6. The latest research from the National Institutes of Health highlights how women's hormonal composition affects HIV progression differently than in men. Estrogen levels can influence how the virus behaves in the body, sometimes masking symptoms until the infection has significantly advanced. But, no worries folks. Hope shimmers on the horizon through groundbreaking research at major American institutions. At the National Institutes of Health in Maryland, scientists have made remarkable progress in understanding how HIV hides in the body. Their innovative shock and kill approach aims to force the virus out of hiding while strengthening the immune system to eliminate it completely. Meanwhile, American Gene Technologies in Maryland has pioneered a promising gene therapy approach. Their research focuses on modifying immune cells to make them resistant to HIV infection. In 2024, their clinical trials showed encouraging results, with several participants maintaining undetectable viral loads without traditional antiretroviral medications. What makes today's HIV testing landscape different from the past is its accessibility and accuracy. Modern tests can detect the virus as early as 18 days after exposure, though the window period varies by test type. Dr. Wong emphasizes that women should specifically request an HIV test, as it's not always included in routine women's health screenings or annual checkups. The story of Lisa Thompson, a prominent HIV activist, underscores the importance of early testing. "I ignored the signs for months," she shares. "I had mild symptoms but convinced myself it was just stress. By the time I tested positive, my CD4 count was dangerously low. Now I tell every woman I meet, don't wait. If something feels off, get tested." As earlier mentioned, not everyone's journey with HIV follows the same path. Scientists have identified a remarkable group called elite controllers, people whose immune systems naturally suppress the virus without medication. Understanding how these individuals control HIV has opened new avenues for treatment research. At Harvard Medical School, researchers study these elite controllers, hoping their unique immune responses hold keys to developing more effective treatments or even a cure. The medical community now recognizes that HIV progression varies significantly among individuals. Factors like genetics, overall health, and access to healthcare can influence how quickly HIV advances to AIDS. Some people may progress within a few years, while others maintain their health for decades with proper treatment. For women experiencing any unusual symptoms, remember Sarah's words, listen to your body. It whispers before it screams. Today's HIV treatments can help people live long, healthy lives, but early detection remains crucial. Regular testing, understanding women-specific symptoms, and staying informed about your body can make all the difference. The future of HIV treatment continues to evolve. With ongoing research, improved testing methods, and better understanding of gender-specific symptoms, we're moving closer to a world where no woman has to face an advanced HIV diagnosis because she overlooked the early signs. Your health matters. Don't let subtle symptoms go unchecked.